Good evening, Los Angeles. I'm back in City Hall at the start of this new year, where I've been feverishly at work with so many committed public servants and private individuals who've been helping us fight this, our toughest moment in our city's history. And usually, I speak to you about COVID-19, and I will do that again tonight. But I need to pause at the beginning of this to speak about what we all witnessed as Americans last night, as our nation's capital was overrun by those who sought to undemocratically overthrow the work of our state legislatures and the work of the voters to elect a president. There are times when our nation's soul is defined by what we do say and what we don't say, and I certainly cannot be silent tonight. In fact, I know I join a chorus of an overwhelming majority of Americans who, yes, are registered in diverse ways as Democrats and Republicans and independents and third-party members who witnessed the assault on our democracy that cannot stand and that we cannot remain silent about. It was shameful enough to see members of Congress defy their oath to not uphold the work of the certification of our 50 states in this country who spoke to the results of what voters across America demanded in a new president. But then to see a violent mob, thugs, force their way into the hallowed halls of our nation's capital. That was not an assault just on our elected representatives, because that's our capital. That is our capital that they assaulted, destroyed, and in doing so, looked to assault our very democracy. When I became your mayor, I took an oath. When I became a Navy officer, I took an oath. And the oath was the same one, to fight to defend our Constitution against all enemies, foreign and domestic. Those who would seek to destroy this nation are our domestic enemies. You can't change a democracy by force. It's what distinguishes a democracy. But I think we all feel just how fragile a democracy is, and how our president, who's acting like a political pyromaniac, bringing the fuel and the fire and lighting the match, needs to stand down or step down if necessary, if he cannot fulfill his responsibility to this nation. Thank you to the Angelenos. It doesn't matter if you liked, loved, or hated the outcome of this presidential election. We will protect your right to be able to speak out about that and your First Amendment rights to be able to express your opinions, joyful or sad. But we will not tolerate here, and we cannot tolerate in our nation's capital, this assault on who we are as an American nation. This is a birthright that needs our attention, and January 20th cannot come soon enough. And we will welcome not only President Joe Biden, but Vice President Kamala Harris, our California senator, who lives right here in Los Angeles, to be able to do the work of continuing this fight and ramping up our resources against COVID-19, rebuilding our economy, combating things like climate change, and taking the issues of the day from homelessness to immigration reform forward. And I look forward to those days. I'm the co-chair of that inauguration. Nobody will be traveling to go there besides those that are in Washington. But I hope all of us can look at the renewal of our democracy that day, take a breath, and continue the hard work ahead. Los Angeles has not been spared from this pandemic, and right now we remain the epicenter, or one of the epicenters, together with places like the state of Kansas, our fellow neighbors in Arizona and Phoenix, of the most rapid spread and the deepest outbreak of this disease in our country. As of January 5th, there were open or active outbreaks in 504 locations according to County Public Health, totaling 9,348 cases in warehouses and in shops and delivery centers. In the city of Los Angeles and in our county, COVID-19 is now everywhere and infecting more people than ever. Our test positivity rate is 21.6% countywide. At our drive-through and walk-to testing centers in the city of Los Angeles, it's 25.13%. We had nearly 20,000 new cases identified today, 19,719 across LA County to be exact. This was a 66.5% increase since yesterday. And we know there's certain days that are higher and certain days that are lower. 8,374 of those identified today were in the city of Los Angeles. The next metric we track is hospitalizations, because that is everything. That is whether or not we will be able to literally survive this, and for so many of our family members, whether they can get through. And today, over 8,074 of our fellow LA County residents are hospitalized, our highest number since the start of this pandemic across Los Angeles County, and 1,635 in our ICUs. Not quite a peak, but very, very slightly down from our peak just a couple days ago. This is triple what it was from last month, triple. And I know numbers can numb us, and so we need to have names and narratives to understand the impact. I know for too many of you who are hanging on tonight because there's a loved one on a ventilator, or somebody you've just checked into a hospital and had to wave goodbye to across a glass door. I know what you're feeling. I'm on the phone every single day with the families who have lost their breadwinners, their parents, their children, and we continue to see more people who don't have underlying conditions die from this. Today, there were 98 deaths in the city of Los Angeles, 218 across our county. Yesterday, we had 259 deaths. That's one more than all the homicides in 2019 in LA City combined. In a single day, equal to a year of homicides. We are not, nor will we ever become accustomed to these numbers as normal, nor will I ever accept them as something we should just live with. Because every single one of those means everything to somebody out there today. This is not sustainable. And we have no choice. As I've said, I know everybody is doing something, but all of us need to continue to do more. We can stretch farther. We can be more vigilant. We can close down our bubbles. And there are too many conversations I have where people are still mixing households, and we cannot do that. This next 2 or 3 weeks will define everything for us. Our own behavior will dictate everything that we do, even as we ramp up efforts on vaccination, on enforcement, looking at the orders that we have out there. Those things are critical, but 10 million people across LA County are an unstoppable force if we align our good actions together. The last 3 weeks have given us a similar number of cases. That's not a bad sign. As high as these cases are, that means for about 3 weeks now, we should end this week and the last 2 weeks before that at a similar number of cases, because we saw in the weeks before that a doubling and a doubling and a doubling. But I don't believe that this is a new plateau that will automatically come down. In fact, it's my belief that this is just a pause before a new peak brought on by the evidence we see of too much movement that happened around Christmas and New Year's. So hold on, because things may get worse. In fact, many indicators point to that. Stay home now whenever you can. Wear a mask, and if there's been exposure in the house, even inside. Wash your hands. Avoid gatherings altogether. And I want to remind people about the existing orders that are there today. If you can work at home right now, the state mandates that you must. So if you're an employer, take responsibility for those employees and send them home. If they're not essential workers that have to be in a work environment outside the home, make sure they are at home. And if you're an employee whose employer is insisting that you go to work, even as you are not an essential worker that needs to be out there, let us know so we can be in contact with that employer and make sure you and your family are safe. And with cases this high, what we're seeing is something that we all can take responsibility for. If you do have COVID-19 symptoms or think you might have been exposed, get tested immediately. And we're seeing record tests. Right now, I believe we're booked up for the next couple days. We have testing available on Monday, and as always, check out in the early afternoon to see if there's tests that have opened up. If your test results come back positive, isolate yourself for at least 10 days from the time your symptoms first appeared, and stay isolated for at least 24 hours after your last fever. As of this week, we've tested 3.5 million people, million tests at city test sites since the start of this pandemic. We're conducting 46,000 tests, up to 46,000 tests each day in those sites in a neighborhood near you. We have 5 walk-up sites, 5 pop-up sites, we've got the drive-through sites, and all the information for those sites and availability and making an appointment is at coronavirus.lacity.org/testing. If you can't access the internet, call us at 311. And as always, if you want to know where our mobile testing sites are proactively going to a place where you don't need an appointment, you can also find that at coronavirus.lacity.org/testing. Even in this moment of extreme danger, I've been joyful to see the amazing work that so many people are doing out there to provide vaccines. I visited, I think, 6 sites already with council members, seeing our public health nurses, our city rec and parks workers, folks from our fire department and others that every single day are making sure that our health professionals are getting vaccinated in that first group. I know that the state website went down early yesterday morning and there was a little bit of a delay, but I also know that people are doing what's right, whether it's through hospitals and providers or whether it's at these pop-up sites that we have in our city rec and parks facilities or other city sites. But I want to say loud and clear, vaccination is not happening fast enough. We need more vaccines. Dr. Fauci said that this week. He said California isn't getting enough, and Los Angeles, as the epicenter, is not getting enough vaccines as well. We have the capacity to do many more. The firefighters that you've seen at the testing centers, the volunteers from CORE, the great nurses that are being hired both on the public side that are there from public health and the private side as we ramp this up, we have the capacity to do much more. And so my message to our national leaders is give Los Angeles what we need. And just as we sent doctors to New York and PPE to other parts of the country early on when they were peaking, this is our peak, and we need you. We need national leadership, we need vaccines, and we need resources to pay for them. Give us those, and we know how to get the job done. I will work closely with the Biden-Harris administration, but even in the last days of the Trump administration, with folks like our Surgeon General, who I've been in contact with this week, we will continue to ask in a nonpartisan way for the help that we need and that you deserve. As the state of California gets more vaccines, so will LA County. And thank you to LA County for calling on us to work with you to help ramp up these centers. But we will do this in accordance with the CDC guidelines. Currently in phase 1A, as I mentioned, are healthcare workers and residents and workers of our long-term care facilities where we saw too many deaths early on. These are the folks at the highest risk of exposure, and we're already surging those teams into our skilled nursing facilities, already surging those pop-up centers for our healthcare workers that can't get a vaccine where they work. But as more vaccines become available, the rollout will speed up. The first tier of phase 1B will likely begin in the first week of February and include people who are 75 years and older and those at risk of exposure who work in education, childcare, emergency services, and food and agriculture. The state's tiered rollout is based on the risks that are associated with your jobs, and I know it can be confusing. I know folks want to be at the front of the line, but I beg you to make sure that you let our healthcare workers who will be there for you if you get sick or a family member gets sick, that they and the residents and workers of our skilled nursing facilities and our senior living facilities get the first vaccines. Everyone should know where you stand in the vaccine rollout, and you can find that information at vaccinatelacounty.com. That's vaccinatelacounty.com. We've lived in fear for so many months. It has corroded us, our souls, our spirits, but we still have summoned strength even in those toughest moments. We've lost too many of our own, and each lost, each person that has been stolen at the hands of this foe has caused us immeasurable grief. That wave crashed down hard on the city of Los Angeles. We've lost a number of employees in the last weeks, but I want to share the story of one of them, Fire Captain George Roque. George was an extraordinary man, and I want to thank his family for the time that we spent talking this week. A public servant who led a fire career of 37 years, 22 years with Los Angeles Fire Department. His hard work was unmatched, his principles were uncompromised, and his heart was open and he gave to all. When he was just 17 years old, George met Hope, the love of his life. And they started a family early, a partnership that spanned 4 decades as they raised 4 children and raised others in their family too, who looked at them as their mother and father. As long as Hope knew him, George was the kind of guy who was always moving, always doing something, teaching hard work to his kids in the backyard, going on a hunting trip with his boys. Channeling that energy and vigor, he started an early career in construction. But as times changed and work grew harder to find, George set his sights on something he dreamed of, becoming a firefighter. And after he became a firefighter, he set his sights on the highest vision he had to join the Los Angeles City Fire Department. He had to learn the basics, take classes in fire science at a local community college. Soon he was sending in interest card after interest card, applying in cycle after cycle of tests, waiting for years for that one opening so that he could get through. But George was no quitter. He believed that you should never stop reaching and clawing for your dreams, and after 4 long years at the age of 35, he joined our department when he got that magical call that LAFD wanted him. He set out on a career of service, saving more homes and buildings and lives than people will ever know. In fact, he saved the lives of people who probably will never know it was he that is the reason that they're still alive today. On the fire line, he was always a leader, acting with humility and courage, always teaching and guiding others as a mentor. He carried a reputation as somebody who set goals and worked hard to achieve them and never hesitated to advocate for others. And he didn't shed those values when he took off his turnouts or hung up his helmet after a call. In the community, he was a mentor to anyone who needed advice, a straight-shooting preacher of tough love to anyone who needed a dose of it, and a source of help for anyone who needed a hand. But his most important role was dad and husband. Through hunting trips and work in the family orange groves, he imparted to each one of his children, to George Jr., and to Sarah, to Tony and Ortega, what this life was about, the skills and lessons that they'd need. And he taught them to never settle, never to act entitled, to love themselves so that they could love others, and to plan ahead and always act honorably. He was proud to have raised strong daughters and strong sons and held them to those same high standards. Before George passed, he sent a text message to each of his children, leaving them with final parting words. "It's all about going forward," he wrote. "That's what I've been teaching you this whole time. Going forward." We all have to go forward, my friends, and take George's lesson to heart. He taught us all that tonight, and we each teach each other this lesson every day that we wake up and we face the day, if that means staying home or keeping our distance, or for those who are on the front line, going to work in the middle of tough and dangerous times. As we face off against this virus, as we push past this period of darkness and of pain, let's heed the words and the wisdom of LAFD Captain George Roque. I know we can. I know we will. So stay safe and stay healthy. And please stay at home. Strength and love, Los Angeles. With that, I'll answer questions. Thank you. First question, please.
And that comes from Mia Lau from the LA Times. Please go ahead.
Hi, Mia. How are you?
Hi. My question is, the FDA recently put out a warning that the curative test that's been used in LA may be producing false negatives. And so the question is, why has LA opened up the testing for all people, including asymptomatic people, when it's well known that that test should only be used for those with symptoms of COVID?
Thank you, Mia. The simplest answer is 92,000. 92,000 people, a full third of all the positives that we have gotten, have been from asymptomatic people. That's 92,000 people who otherwise might not have known, might have been spreading, and might have seen this explode even more. But I want to say a few things as well. One, this test is used for both symptomatic and asymptomatic people in countless jurisdictions, by the United States Congress, by NBA, and people with symptoms, because I know people might not hear the detail, and I know you have the nuance there. But let's be clear what the FDA said. For people with symptoms, they didn't issue any further guidance. It works, there's no issues. And that's been 2/3 of all the tests. Second, as I mentioned, 1/3 of the tests that we've tested and found positive are asymptomatic people. And I'm not gonna ever apologize, because there was I think a lot of debate about whether asymptomatic people should be tested or not. And what the FDA guidance says is, like any test, you have to do it and use it correctly. So I'll remind people, if you're taking this test, you have to cough vigorously 3 to 5 times. You have to make sure you follow the guidance that we have in the videos and on the sheets that are there as well. To be clear, the CDC does recommend testing asymptomatic people. And there's no test that is quote unquote approved just for the asymptomatic people. So that's not unique to the curative test as well. So the message is, of course, use this the right way. The proof is that we've had a third of people, nearly 100,000 people who would have gone undiagnosed that we were able to catch because of this test, and that it has helped us predict those surges in hospitalizations and deaths as a result. To me, that proof is in the pudding. And the CDC is clear, and the FDA has not recommended withdrawing that. And when we look at the countless jurisdictions that use that, we will continue to, and just remind people it has to be administered the right way. That guidance, with no data behind it, by the way, said it has to be used right. If it's not used right, it may sometimes not catch all the positives if you don't have symptoms. But that's not unique to this test. And lastly, we always remind people with the PCR test, it won't catch 100% of the time, especially early on, and less so with asymptomatic people. But in terms of controlling this, I'd rather have more information than eliminate it altogether. Thanks, Mia. Next question.
Thank you. And that comes from Claudia Pashuta from KNX News Radio. Please go ahead.
Hey, Claudia.
Hi, I have some follow-ups on the FDA alert.
Sure.
So it also notes that the test should be administered under the direct observation of a trained healthcare worker, which we know isn't happening at the city sites. You get the video, and then you swab yourself, and then you put the test in a container. So, why is the city doing it that way? Any plans to change that, given the FDA alert? Why do you think the alert was issued now? Do you have any concerns that this test may have any more false positives than any other test, that false negatives?
Yes.
Might false negatives be helping to drive the surge? People perhaps getting a false negative and thinking, oh, cool, I can hang out with my family over the holidays. We know that it is not a path for doing so, but some people might take it that way.
Sure.
And then my second question is, as one of the co-chairs of the Biden inauguration, what's your role in the planning, and what security concerns do you have given what happened yesterday at the Capitol?
Absolutely.
Thank you.
Thank you, Claudia. Let me stick with the first question first. No, the FDA has been clear, and they haven't withdrawn that, and CDC recommends it still be done. I would love the FDA, because it was a very vague warning. It didn't have data behind it, and it didn't say withdraw that, to give us clinicians. But this has been one of the problems. The federal government has basically told cities, you're on your own. And we know that most doctors and nurses are on the front line fighting COVID-19. To be clear, there are trained health professionals. They're called paramedic firefighters. They're on every single site. They're not the ones reaching into cars to tell people how to do it. But 92,000, the proof's in the pudding to me. 92,000 that we have caught. And it's a little bit of a false choice. The choice is whether we find those 92,000 or not. It's not like there's some other test that FDA says is better or that's working better on asymptomatic. The implication is don't do asymptomatic testing or do it. I'd rather do it and continue to push forward with finding those tens of thousands of people that every single month now we are finding who are asymptomatic and being able to control that spread. You raised one last good point on this question. This has never been an excuse to party. A negative is not a test is not an excuse to violate the orders that are out there. You don't go and get a test so you can break the state or local orders and mix households or go on a trip. Those orders are in place, period, and we will always prioritize the symptomatic people first, asymptomatic second, and it has played a critical role in being able to control that. With the other question on security, of course I have those concerns. Of course I have the concerns, and I know that there will be a lot of lessons learned. The Capitol and the inauguration, which will be outside, as it is all the time, can be a vulnerable space, especially as we see, a mob like last night, a group of rioters and folks who essentially were trying to incite a domestic coup. So as one of the co-chairs, there's 4 of us, I think, that are co-chairing this inauguration, been in regular contact with, and I know that there are not only security measures being done by those folks that are responsible for the Capitol, but also at this level by the Secret Service, given that the President and Vice President, it is their inauguration. So expect an elevated level of security. I think that we cannot, though, back down from owning this democracy. We won't be scared away from the peaceful transition of power. You do that, and that's exactly what opponents of democracy would like to see. So I know that there will be lessons from last night. I'm being briefed this weekend. happy to share publicly what I can. Obviously, a lot of those security measures will be private. Thank you, Claudia. Next question, please.
Thank you. And that comes from Ron Lynn from the Los Angeles Times.
Hey, Ron.
Go ahead.
Hey, Mr. Mayor, thanks for taking our questions. Really
Always.
appreciate it.
Sure.
Los Angeles has been coping with an unprecedented COVID surge in our hospitals for weeks, and it is only expected to continue. What would you say to the healthcare workers who are stretched thin, and likely will carry this trauma for years to come? Thanks very much.
Well, I talk to them every day, Ron, and I hope all of us realize the trauma that we're living through. First, for those who have lost a loved one, and then second, not in a ranking, second, for those healthcare workers that have witnessed that death, who have witnessed that suffering, who have been traumatized, and I hope all of us will picture ourselves in that role for a moment. When we're deciding whether or not we're going to mix a household or just go for that little drive out of town to visit somebody, or whether we can get together and throw a little party nobody will know about. You've got folks that will, for a long time, I think, have to unpack, just as we have war medics who come home from the trauma of war, who we will need to treat and to make sure that their mental health is taken care of. We saw that in New York early on in this pandemic, and while we haven't gotten to the level that we saw there, we're still way under the per capita deaths of New York City and, in fact, many other cities across the country. Those numbers continue to climb here. And it only takes one traumatic death or one traumatic moment where you're having to decide between life and death for patients to scar you for the rest of your lives. So I'd say to them, first and foremost, you are our angels, you are our heroes, we see you. We've never stopped seeing you. It's why our city made sure we procured PPE for you so that wouldn't be a stress. We bought those ventilators and helped bring them, why we are searching around this country and making the pleas like I've made to get workers from other parts of the country so that you can maybe take a few hours to get some precious sleep. And secondly, after this, we will also remember you and continue to deal with that trauma and do whatever we can to help you through that. And third, this is why I'm asking everybody to do what's right. These healthcare workers aren't some other group of people that happen to come to Los Angeles. They're our brothers and sisters, they're our parents and children, they're our neighbors. And so these healthcare workers are us. And whatever we can do to make sure we don't have further loss of life and that they don't have to witness that is something to make sure that we can rise again as a city. So I say thank you, we've got your back, and we will continue to have your back as well. Thanks, Ron. Next question, please.
Thank you. And now to Leslie Marin from KCAL-CBS.
Hey, Leslie.
Go ahead.
Hi, Mayor. Just going back to the curative tests and the FDA warning, one last question on that. I know that the county, Dr. Barbara Ferrer, actually said that nasal tests produce fewer false negatives. Does the city have any thoughts about possibly changing over to those, fully changing over to the nasal test, or are you guys pretty set on the curative oral swab, and how much do you trust it after this warning came out?
Sure, deeply. I trust it deeply, first and foremost, and I think it's really important as we report this, because I think some of the headlines will just say false negatives. Folks with symptoms, there's no guidance of FDA saying there's anything but is effectiveness. I've actually read a number of studies. I remember being challenged early on and talking to a lot of health professionals between nasal or the oral ones, and it wasn't, people were saying oral wasn't going to be as accurate as nasal, and most of the research shows it's equal, in some cases better. Second, it is not an FDA warning. That's the wrong language. The FDA has not warned. What they've said is use this test right on asymptomatic, and like all tests, of course, the place that it can be used much more as a diagnostic tool is with symptomatic. This is about safety, and this is about communication. And quite frankly, I'm open to anything. If we're provided with the clinicians of the federal government, if they want to pay for the tests, if they can procure them elsewhere, but we've stood up the strongest testing program in the United States of America. I still get calls every single day from mayors asking, how can we do it that way? How do we get the volunteers? And we've had core work in other cities. How do we get our firefighters to do this? How do you get this many people through? Dodger Stadium is the largest testing site in the country, if not in the world. And so those results on the symptomatic side have been brilliant. And on the asymptomatic side, as I said, 92,000 people have been caught, a full third because of that. So of course, I always like when I wish there were more data, I wish there were more detail. If FDA says make sure you're doing it the right way, absolutely. We'll double down on that education and letting people know in that car, as I'm doing tonight, cough those 3 times or 4 times to make sure you're getting the right stuff in your mouth. But this is something that has saved lives, will continue to save lives, and if we move away from it, I fear that we would have a lot fewer people diagnosed and even more spread. Thanks. Next question.
Thank you. And that comes from Albert Cerna from Boyle Heights Beat. Please go ahead.
Hey, Albert, how are you?
I'm good, Mr. Mayor. Thank you for taking the time for our call, our questions. I have a few questions. Number one, LAUSD issued a notice to staff and faculty that students who receive fails for the fall semester will be turned into incompletes, giving the students the opportunity to change that grade. I wanted to know what your thoughts are on that and if you knew about it. Secondly, I wanted to ask what you had to say to those folks who had showed up in downtown Los Angeles yesterday at the same time as the insurrection in the Capitol. And then finally, during the New Year holiday, a lot of members of the LGBTQ community went to Puerto Vallarta and were seen without masks and without any kind of protections in regard to COVID. I wanted to know what you had to say to the LGBT community who continue to do this and be part of that. Thank you.
Sure, let me work backwards. Obviously, a community is much bigger than a group of people. If they happen to be LGBTQ, that's, that's a good thing, and there's no issue towards the LGBTQ community per se. But as we've done with every community, like we see higher rise in the Latino community, as we saw early on, more deaths in the African American community, the Pacific Islander community. Sometimes it's pre-existing conditions, sometimes it's suspicion about healthcare. We did a great press conference today in South LA to make sure that African Americans and Latinos will move forward with vaccines, even given the history, particularly with African Americans, of medical experiments and other things that might give them distrust. And I would say this is not a time to be partying anywhere. There's a mandatory isolation quarantine when you come back of 10 days if you leave this city. And right now the guidance is against that, full stop, period. And are you really going to have a few days of fun that results in somebody you know being hospitalized or worse yet dying, or even you? Don't do it. I've said from the beginning of this, don't be stupid. I know how tough it is right now. I know how much people need to be together. I know how much they want to be together. But if people die, they will never be together. So that's my message there. Second, in terms of downtown, my message is if you're coming to peacefully express yourself, we're going to help you. We always have. Remember, after 2016 elections, 2017, we had nights after night after night, I think it was 3 or 4 nights, of marches here downtown, where I want to thank our LAPD officers who accommodated and facilitated people's First Amendment and free speech rights. Similar here, and I'm not going to give you the protection based on what you say. I could completely disagree with what you're saying. There's guidance asking people to not yell, to try to make sure you're not spreading, to wear masks, et cetera. But if it's the content, anybody can say anything. That's your First Amendment rights, and it's protected, though I would encourage people to maybe do that more virtually right now, given the dangers to yourself with COVID. But if you're coming here to cause mayhem and to attack, and I want to thank our officers, and I want to thank the folks who were out here peacefully protesting. There was only one kind of exchange and one bit of violence yesterday, and we will act swiftly on those. Folks are expressing themselves. You have the right to do that, but anybody who would seek to break property, attack fellow Angelenos, you will be dealt with swiftly by the full force of the law, and that in doing that, we are protecting our democracy. And LAUSD, yes, I did know, fully supportive of that. I think we've got especially too many of our young people who are in low-income areas, communities of color, folks that don't have the resources, whether it's the broadband connection or the equipment, don't have the family member at home who can help them, who we need to make sure we're already failing them. Let's make sure we don't give them a failing grade. That incomplete is something that allows us to catch up, allows them to have a fresh start, and allows us to make sure that we take responsibility for their education. So I applaud the board and the superintendent's move to do that, and I look forward to whatever way the city can assist in that, as we've been assisting by having child care centers and safe places where people can do their virtual learning. We will be there for this district as well. Thanks, Albert. Appreciate it. Next question.
Thank you, and that comes from Laura Nelson from the LA Times. Please
Hey,
go
Laura.
ahead.
How are you?
Hi, Mayor. Just to follow up on the curative topic, I'm curious whose medical advice you were relying on when the city approved the curative test for use on asymptomatic people, going against the recommendations of the company and the FDA. And I'm curious why LA hasn't maybe switched over to another test, because the FDA has approved at least one that's allowed to screen asymptomatic people, and that it's beneficially approved for that use. So those are my two questions.
Sure.
Thanks.
I think bottom line was good results. We talked with public health. We talked with folks who obviously are part of this company, our own doctor here through Los Angeles Fire Department, our Emergency Operations Center, and the coalition of folks that we bring together who are our medical advisors. It was clear, and the proof has been clear, that this catches asymptomatic cases. There have not been FDA approved throughout this and available, to be clear, tests, and scalable. See, there's three things you need to do if you're going to stand up testing. You need to be able to make sure you can do mass testing, one. Two is you need to make sure that they are going to catch positives. And three, you need to have the personnel to be able to staff those. As I said, we have been left out on our own. Anybody who's critical about this, FDA or others, and to be clear, the FDA is saying do it right. And they don't prohibit this use. They say, make sure it's done the right way. That is something that for us, that proof has been in the pudding of who we've caught. Would I like to catch 100%? Yes. Do I know what the percentages that are not being caught? No. But even symptomatic people, we're not catching all of them because they're not always doing exactly right. But we could get it perfect with maybe 10% or 20% of the tests that we do right now, and we'd be leaving 80 or 90% of people behind. So it was what was available, it's what works, and it's what has proven itself as well. It's good results, it's easy to administer, and it's scalable. And that is something that's unmatched. And so we have seen that. Again, I think if folks want to report that that the results that we're getting are not catching the positives, I would look at that and look at that rate as well. It is no other place in the country, I think, that's been able to catch as many asymptomatic people at the city level. And that has been a testament to how we've been able to do this. But of course, we'll always follow that. And it's not just FDA, it's CDC. And I know this wouldn't be the first time federal agencies don't say the exact same thing, but they're not in conflict. FDA is saying use this right. CDC is absolutely use asymptomatic testing. And if we can get that supply from a variety of sources, we're never wed to just one test or one source. We're wed, though, to making sure it's as widely available and is working. And we've seen both of those things happen here. Thanks, Laura. Next question.
Thank you. And that comes from Brian Eckhouse from the Bloomberg News. Please
Hey,
go
Brian.
ahead.
How are you?
Hi, Mayor. Thanks for making the time tonight. I appreciate it.
Sure.
I'm trying to understand how California, LA County in particular, got to this point in the pandemic where you said that they're now an epicenter. We're an epicenter here. Yep. California is the first stay-at-home order in the spring. Numbers were relatively low then. You've had now a stay-at-home order since November, and now the county is an epicenter. How did it get here? How did the city, the county, leapfrog over places around the country that may not have had a stay-at-home order for 2+ months now?
Yeah. I think people look at a simple, like, what's closed leads to, lower cases, or what's open leads to more cases. The simplest answer has been that Los Angeles is the densest populated metro area in this country. So when you look at the CDC, which puts a vulnerability index, there's actually a numerical number. Los Angeles has always been at the top of that list, or near the top of that list. People think of New York as dense, and there's dense neighborhoods in New York, but New York is actually the 5th densest metro area. We're the #1. And just because we don't have skyscrapers everywhere, we know that inside homes where one family is, there's 2 or 3. So once that spread happens, we've known that we've had this vulnerability with poverty, pre-existing conditions, and density the entire time. I have no doubt in my mind that stay-at-home orders have protected thousands of people. In fact, I think the number of deaths per capita, I looked at a few days ago, so it may have adjusted a little bit, but it's still about a third, certainly under half of what we saw in New York City. And it was under, Chicago, it was under Phoenix, it was under like so many other cities as well. And I believe that's because of our early action, and I believe that's because of our early work. But we also have never said, this is a really tricky virus. And so the second reason is I think people let down their guard. We saw spikes. Certainly, I think we got used to it here. Colder weather did drive some of us indoors, but it's still warm enough here for people to say, hey, let's hang out with each other in a way that doesn't happen in other places. And we've seen Thanksgiving, no doubt, a spike that came from that. I'm praying that the Christmas and New Year's spikes are not as big. We do expect them to happen because we saw that movement. And that's why every time I come before saying, cancel those plans, don't do it. It's why we're ramping up the enforcement and continuing the enforcement that we have. I know nobody asked in Q&A, but I'll say this proactively too. What we witnessed, I think, in Century City at the mall, for instance, we've been very clear, had good conversations with LAPD and the chief, where people are coming in to disrupt, just like we saw folks who were disrupting and entering our nation's capital. If they're entering a store where you have to be wearing a mask and literally potentially spreading and or killing people, we won't have officers who are standing by witnessing that. We will take action, and don't test us on this, because you will find yourself in jail, cited, or dealing with prosecution. So we are very clear about the vulnerability that we've had. We've seen that come home, and the personal responsibility, and I think it's those two things. You know, I think the only other place that matches us right now is Kansas. So everybody who wants to have a definitive theory, Kansas is not very densely populated and probably has much more open. That's proof that, you know, when people are further apart from each other, that what you have open and closed does affect the cases. But vice versa, having things closed here in Los Angeles, that's good, but the density, that's tough. And so you put those things together and you have two places that right now are the peaks. It's always a combination of different things, but I come back to that. We've always been the most vulnerable. We've still had lower death than other peer cities across the country, and the worst moments that we saw in places like in the Northeast and in New York City. And I pray that we can get through this month, keeping that going thanks to the amazing people in our hospitals, the lessons that we learned, the way we're able to surge, and some of the preventative work we can do now. Thank you. All right. I'm told that that was the last question, so I'm going to, as always, turn to Spanish. Thank you to members of the press. Thank you to the members of the public, as always. And thank you to Angelenos for doing your part. And I just wanted to end this before I go to Spanish, where I ended before. God rest the soul of Captain George Roque, and my love to his family and to the LAFT family as well. Muy buenas tardes, Los Ángeles. Antes de hablar de lo último en nuestra lucha contra la pandemia, quisiera abordar el tema de la protección de nuestra democracia. Como tantos, quedé pasmado y horrorizado por el ataque en la fundación de nuestra república ayer. Ya era demasiado vergonzoso ver a los congresistas, quienes juraron proteger nuestra Constitución, decidir a desafiarla. Pero con ver la muchedumbre violenta forzar su acceso al Capitolio, la ciudadela de libertad, inspirada por las mentiras y odio del presidente Trump, el presidente de los Estados Unidos, era repugnante verlo. Estas acciones no reflejan nuestro pueblo. El presidente y sus aliados republicanos deben denunciar esta violencia y la ideología que lo provoca. Nuestra democracia es frágil y siempre necesita nuestra atención y energía. Esperamos con anticipación en el 20 de enero, cuando podemos empezar nuestra recuperación de nuevo. Mientras tanto, tenemos que seguir con el reto inmediato. La pandemia sigue afectando nuestra ciudad y nuestro país de manera muy destructiva. El COVID-19 está ahora en todas partes de nuestra ciudad y condado y está infectando a más gente que nunca. Hasta el 5 de enero, 504 lugares no residenciales en Los Ángeles han tenido brotes. En total, 9,348 casos. Nuestra tasa de positividad es 21.6%. 21.6%. Tuvimos 19,719 nuevas infecciones hoy en el condado de Los Ángeles, un aumento de 66.5% desde ayer. 8,374 de los nuevos casos estaban en la ciudad de Los Ángeles. 8,074 personas están hospitalizadas por COVID-19 y 1,635 pacientes están gravemente enfermos en nuestras unidades de cuidados intensivos. Y hoy hubo 98 nuevas muertes en la ciudad de Los Ángeles y un total de 218 en el condado. No podemos seguir así y no tenemos otra opción que cambiar nuestro comportamiento. Todos debemos hacer aún más para frenar la propagación de este virus en Los Ángeles. Y la aumentación de este es desproporcionalmente en nuestra comunidad, la comunidad latina. Por eso, quédese en casa siempre que pueda. Lávese las manos. Siempre use una mascarilla fuera de su casa y evite las reuniones por completo. Si tiene síntomas de COVID-19 o cree que puede haber sido expuesto, hágase la prueba gratis de inmediato y póngase en cuarentena hasta que reciba un resultado negativo. Si el resultado de su prueba es positivo, aíslese durante al menos 10 días desde el momento en que aparecieron los primeros síntomas y quédese aislado durante al menos 24 horas después de su última fiebre. A partir de esta semana, hemos realizado 3.5 millones de pruebas en sitios en la ciudad. Estamos realizando hasta 46,000 pruebas cada día en estos sitios. En este momento, todas las citas están reservadas. Estamos aumentando la capacidad constantemente. Y nuestros sitios móviles y peatonales aceptarán a las personas sin cita. Más información está disponible en coronavirus.lacity.org/testing. O llame a 311. Aún durante todo esto, he sido inspirado por los miles de trabajadores de la salud que aprovecharon nuestros sitios de vacunación para recibir la vacuna. Sin embargo, el proceso de vacunación todavía sigue muy lenta y espero trabajar con la administración Biden-Harris para acelerar este proceso. Necesitamos más vacunas y necesitamos más vacunas ahora. Ahora en el estado y el condado están adoptando un enfoque gradual para el lanzamiento de la vacuna, de acuerdo con los guías del CDC. Estamos en la fase 1A, con prioridad para los trabajadores de la salud y los residentes en centros de cuidado especializados para personas de mayor edad. La fase 1B probablemente comenzará en febrero para personas mayores de 75 años y personas en riesgo que trabajan en educación, con niños, en servicios de emergencia o en alimentos y agricultura. Se espera que la vacuna esté abierta a la población en general en la primavera. Todos deben saber dónde caen en la distribución de vacunas y pueden encontrar esta información en vaccinatelacounty.com. Hemos vivido con miedo durante muchos meses. Hemos perdido demasiados y cada fallecimiento es doloroso. Esta semana perdimos a otro de los nuestros, capitán de bomberos, George Roque. George era un hombre extraordinario, un servidor público y generoso. Él era un líder, humilde y valiente, y siempre enseñando y guiando a otros. Estuvo 22 años con nuestro departamento de bomberos y obtuvo la reputación de trabajador y defensor para todos. Antes de fallecer, George le envió un mensaje de texto a cada uno de sus hijos, sus 4 hijos, dejándolos con las últimas palabras de despedida. Todo se trata de seguir adelante, escribió. Eso es lo que te he enseñado. Mientras nos enfrentamos a este virus y superamos este periodo doloroso, prestemos atención a las palabras y sabiduría del capitán Roque. Sigamos adelante. Así que manténganse seguros, manténganse saludables y por favor, quédense en casa. Fuerza y amor, Los Ángeles. Gracias y buenas noches.